Sir, my legs have a bone deformity. Can your treatment help to correct this?
Without seeing the patient, I cannot confirm if my legs have a bone deformity or if they are indeed crooked. However, sometimes the appearance of crooked legs can stem from a bone issue or an advanced bone problem. If there is a significant issue with the bone, patients like this should seek help from orthopedic doctors. Because orthopedic specialists can reshape the bone through surgical cuts, making the leg's curvature more reasonable, they can solve or reduce the leg shape issue. Thus, to provide a complete answer to this patient's question, we need to examine the patient directly.
The leg type we refer to as a footballer's leg is one we can work on, Professor, okay?
So we can proceed with the intervention and enhance the leg's appearance to be more elegant and beautiful. It could happen.
Teacher, I am modeling. Will there be a scar after the surgery? If so, how long will it last?
If we will perform a fat injection, there will be 5 to 6 minute incisions that we will make for liposuction. Should we proceed with silicone prosthesis surgery, expect a 3-4 centimeters incision at the back of the kneecap. It's important for me to clarify this. Our team, we are not a specialty that can completely eliminate scars. We can reduce scars. We can conceal scars. This is essentially how we practice our art. Thus, if surgery is taking place, we must acknowledge the potential for scarring and accept it. To say we can do these surgeries without any scars would be a bit unrealistic. I refrain from saying this as it doesn't fit my character. That would not be true. Indeed, we fear scars just like you do. We aim to reduce them, but we can't assure you of a scar-free outcome. This does depend on the patient's body, but usually when we perform fat injections in the leg, we don't see any significant issues or pain. In fat extraction and liposuction areas, patients may feel sensitivity, but we don't say there will be serious pain. But if we are going to do a prosthesis, there is a crucial aspect to consider for those patients. At first, patients find it hard to stand flat on the ground. Therefore, we always tell our patients undergoing prosthetic surgery this: the high-heeled shoes that you can comfortably wear and take off even when coming to the hospital for surgery are 3 to 4 centimeters. Wear high-heeled slippers for easy walking in heels. Patients with silicone prosthetics must be able to stand flat on the ground. It takes at least 5 days and up to 10 days to comfortably stand flat. So, regarding prosthetics, if we try to stand flat too early, we will experience pain. High heels solve this pain problem. We are attempting to address the problem.
Teacher, the prosthesis scares me a lot. I want to have fat transfer done. What is its durability?
That's a good question. It's beneficial to explain it. We estimate that roughly half of the fat we inject in fat injection will be permanent. Normally, medical literature states that 46% is permanent. Why quite key? Let's go with the average. Half will be permanent and half will dissolve. There is a fundamental error in the information found online. After the remaining part of these fats that will dissolve is left behind, in 2 to 3 years, people believe the other areas will also dissolve. This is not a reality. The fat that has melted is gone, and what remains will last forever. Thus, fat injection is a permanent choice. This is a solution you can use for life. I believe you should inquire if a second session is necessary for fat injections. Yes, theoretically, a second session might be needed according to medical guidelines. Since I apply a different method, I can confidently say that 90% of patients won't require a second session. We can't guarantee 100%. It's essential to avoid making such grand statements. In 90-95% of cases, we can create a beautiful and elegant leg line without requiring a second fat transfer session.
Well, doctor, another question our patients are curious about is how much of this fat will dissolve after surgery.
I even see and enhance it. It's not solely about weight loss. Teacher, we sunbathed when we went out into the sun. Teacher, we entered the solarium. Teacher, we went to the sauna. Do these fats melt? Yes, friends, we also put margarine there. It will melt. Does it melt? You're at 1 kilogram now, went to the sauna. Does the fat in your body disappear when you sweat? If it were that easy, we would all be free, starting with me. Therefore, the injected oils when you exercise or go to the hammam, sauna, when you go into the solarium, they don't melt like butter or margarine does, only because they are now your living, breathing cells. When you gain weight, those cells get larger, and when you lose weight, they get smaller. When you lose weight, just as your body gets slimmer, the volume of the fat in the areas we injected decreases, and you get a bit slimmer. But since those fats, those cells are alive there, you see a bit more thickening when you gain weight. Therefore, they do not just disappear when you lose weight.
If you can only solve the crooked leg problem with fat transfer, then what's the need for a prosthesis?
We can't solve every patient's issue just with fat. Sometimes the level of deformity and the amount of defect can be so overwhelming that it is unavoidable to seek some support from a silicone prosthesis. This is the first option. The second is that sometimes patients say, "Doctor, I want my legs to look muscular." Ultimately, tastes and colors are subjective. If a patient desires a muscular leg look, we cannot create that with fat injections or fillers. In that case, we have to resort to using silicone prostheses. These are simply choices, preferences, and personal tastes.
My doctor said that the deformity in my leg could be solved with a prosthesis. How long does the prosthesis last? Will it need to be replaced again in the future?
Let me clarify this. We typically use silicone prostheses in 3 main areas of the body. The most commonly used area is breast prostheses, which we use for breast augmentation. Sometimes we also use them for buttock enhancement. There are also buttock prostheses and silicone prostheses that we use in the legs and calves. Manufacturers always say these prostheses can be used for a lifetime. I tell my patients that after 10 or 15 years, whether for breast augmentation or not, they should consider this. After 10 or 15 years, this area should be assessed using ultrasound or MRI. If no issues are foreseen with the prosthesis, that is, if there are no radiological concerns, you should keep using it. If there is a suspicion of a problem with the prosthesis, I say that it would be healthier to replace that prosthesis with ultrasound or MRI. Therefore, friends, after 10 years or 15 years, we will check with ultrasound. If there is no problem with the MRI, continue using it. If there is a problem or suspicion, then it would be healthier to replace it.